So when patients are diagnosed with ankylosing spondylitis, it is a lifelong diagnosis, and many of my patients are very concerned that they won't be able to do the things they enjoy. For ankylosing spondylitis, activity modifications are really going to depend on the patient themselves and how much the disorder is affecting them. Some people may be able to continue all of the activities they did before, just with treatment, with medications and maybe injections if needed. Other patients, if their disease does progress, may need to modify some things, but trying to do everything possible to optimize their treatment and then taking it one day at a time is the best way to go. The number one thing you do not want to do is smoke. Smoking has been shown to increase pain and limit function in people that have ankylosing spondylitis. Another thing is exercise. Exercise is incredibly important for people with ankylosing spondylitis. We know that inactivity actually worsens pain, so the more patients can keep moving, the better they're going to feel. In addition to that, making sure that they're compliant with and stay on their prescribed medications are very important. If for some reason the medications are having certain side effects that they dislike, instead of just stopping them, I caution patients to really talk it through with their treating physician so they can come up with either alternatives or different plans. So since ankylosing spondylitis affects your spine, it is very important to be cognizant of your posture. And a lot of that will stem from really strengthening your postural muscles in your upper back and spine and core. But it's also really important during your day-to-day activity, whether you have a desk job or are moving around, that you really are cognizant of your posture. Because even if you're exercising your postural muscles every day or a few times a week, it's not the same if you end up kind of slumped over in front of a computer typing. You really want to be aware of having good posture. In ankylosing spondylitis, since it does affect your spine, some of the joints can have more inflammation, and over time, if the disease progresses, that can lead to certain spinal deformities. So that's why it's even more important to really keep an eye on your posture and those postural muscles and keep them as strong as possible. If you feel a flare in your pain or you feel like something's not working, be vocal about it with your physician, because there may be other options that you don't know about yet, like certain injections or other types of referrals to different therapists where they could help you overcome whatever obstacle there is there. Some may have to modify their activities over time, but overall people can stay active, and one of the goals of treatment is to keep you as active as possible.